Let's talk a minute about what we can do to treat and manage sacroiliac joint dysfunction or sacroiliitis. Once we've talked with you, we've made a diagnosis, we've done the provocative testing and done an injection to confirm, what are the options? What can patients do? Patients will often start with some medication. I don't think that medication is a great long-term solution to sacroiliitis, but NSAIDs can be used. We would want to avoid using opiates. I think physical therapy is probably the cornerstone for sacroiliac joint management. Working with a physical therapist, a lot of times the chiropractors are very helpful with this, and finding exercises and ways to strengthen and stretch the appropriate areas. We want to be thinking about the whole spine, not just the sacroiliac joint. So I would encourage anybody with a sacroiliac joint dysfunction to have a good physical therapist and or chiropractor that you're working with on a continuous and ongoing collaborative effort, and then doing the exercises on a regular basis at home. Some patients, especially with an acute SI joint injury or during pregnancy, will wear an SI belt to provide some support to stay moving. And then we start getting into injections. We do, the pain doctors and the radiologists will do injections into the joint with steroid and an anesthetic. There's a lot of people that are doing biologic injections as well, because the SI joint is supported by a ligamentous complex. And if a biologic can help strengthen that ligamentous complex, then that can be restorative to the function of the joint, and that's something that needs to be researched and studied more. Radiofrequency ablation is where the nerve that goes to the joint is burned so that it's more numb and you don't feel the pain as much. The biggest issue with radiofrequency ablation with the sacroiliac joint is it's really hard to burn all of the nerves to the joint because it's a large joint and there's nerves that go all the way around it. And the place that you can burn most easily is in the back part of the joint. So radiofrequency ablation has some positive things, but also may not be sufficient for some patients. Patients that have really made a concerted effort, usually 6 months or more in this arena, are candidates for surgery. And there's different techniques, different ways to do a sacroiliac joint surgery, which would be a sacroiliac joint fusion. In my practice, thus far have done about 200, well actually exactly 200. We just did our 200th case last week where we go in and put pins across the joint, which provides immediate stabilization. The outcome from surgery is about 80%, which means that 80% of patients get better from surgery. And that's, again, patients that have really not had relief with everything else. So I think the outcome from surgery is actually pretty good. And it's an outpatient procedure through a small incision. The open SI joint fusions are rarely done anymore because the minimally invasive treatments are so good now. So that's kind of an overview. I would say don't forget about nutrition and about just healthy living as the cornerstone of all musculoskeletal care and sacroiliac joint. And then these are some of the other options that are available beyond that. Thank you.